Well, I would agree. I think the naltrexone has a bit of a niche following. You need to really want to not be using opioids at all. I mean, there's the the transition period, as you've said, is quite difficult. You have to truly be off opioids, both sort of, so to speak, detoxified from them, and then maintain a period of that 10 days or so where you can't use, despite all the cravings, any opioid. What then, of course, occurs is you get the naltrexone injection, which will prevent any of the opioids you use from causing any psychological effect. The craving may still be present, and you have to be really willing to not use any opioids ever, or at least in the 30 days that that drug that you've just got injected into you is psychoactive. I mean, the daily use of oral naltrexone is probably not going to be very effective for that reason. Most people are not going to be able to not use opioids and follow their cravings. It's just that they're that intense. So people who have a good, for example, if you're threatened to lose your job, if you use opioids, you might be willing to take naltrexone, or get divorced, or have some other major life impact if you continue to use opioids. Many people might agree to do that. The problem too with naltrexone is it's said to take away some of the other pleasurable aspects of life, because some of the things we normally gain pleasure from are, some of those effects are mediated through endogenous opioid release, as well as dopamine and other things. So there does tend to be a little bit of a blunting of some of the pleasurable parts of life. Now, again, many people are willing to do that, and it's a very effective drug if you're able to take it. But you're right, the other two are much more user friendly. They